Okay, so today we're going to talk about oral anti-diabetics. So we have 7 different classes right here, and we're going to get started. The first class we're going to talk about are the meglitinides. The drug here is repaglinide, which is Prandin. Zoom in on that so you can see it. So this drug specifically can be used for type 2 diabetes, and it can also be used for high postprandial glucose level. So postprandial is going to be after you eat a meal, so after prandial meal. This particular drug is going to increase insulin production from beta cells. So these 2 drugs right here are going to cause the pancreas to make more insulin. It's called an insulin secretagogue. I'm not going to be able to say that word correctly, but that's how you spell it right there. So these 2 drugs, the two drug classes, the meglitinides and the Sivanna Ureas, are going to cause the pancreas to increase making insulin. So specifically this drug class again, repaglinide is the drug. The adverse effects are going to be hypoglycemia and flu-like symptoms. Nursing implications of that, the patient's going to want to take this drug with a meal or within 30 minutes of a meal. And this drug is really good for erratic eaters. So if you have somebody that is a shift worker, or if somebody's like, oh, I'm not hungry, I don't want to eat right now, when it's typically lunchtime, this would be a good drug for the patient to take. The next class is Sivanna Ureas, which is another insulin secretagogue. I cannot say that word. Secretagogue. Let's say it's that, secretagogue. So there are 3 drugs here in the Sivanna Ureas class, glipizide, glybride, and glimepiride, which are glucotrol, diabeta, and amaryl. I'm going to let you have a moment to look at that. It's these 3 drugs right here. So these drugs are going to increase insulin secretion and decrease glucagon secretion. So for specifically, the patient's going to need to have functioning beta cells. So their pancreas has to be able to work a little bit in order for this drug to help them. So the adverse effects are again going to be hypoglycemia, feeling of fullness, and possibly a skin rash. These drugs are going to be contraindicated in people that already have conditions that cause hypoglycemia, or in patients who have a sulfa drug allergy. Remember, they are a sulfonylurea, sulfa. They're sulfa derived. Nursing implication is that this drug can be given daily at breakfast. So remember, these 2 drugs classes right here are insulin secretagogues, however you say that. They make the pancreas increase the insulin secretion. This one is good for erratic eaters. Meglitinides and sulfonylureas are given daily at breakfast. So I guess for this one, since it says erratic, you can think of like a megalodon, like those really big, crazy sharks that lived thousands of years ago. And they're probably pretty erratic in the ocean, swimming all over the place looking for enough food to feed their mega appetite. So meglitinides, however you say it, I'm going to think of a megalodon, and a megalodon is a big, crazy, erratic shark in the ocean. And who knows? I'm just going to put 2 and 2 together. So the next class, we're going to get away from the insulin secretagogues, however you say it. We're going to come over here to the alpha-glucosidase inhibitors. I'll give you a second to look at it. These drugs are going to work in the intestines. So now we're into the gut. Acarbose, the brand name is Precose. See if you can see that. I want you to think pre-meal. So the patient is going to need to literally take this drug with their first bite of food or right before their meal. This drug is going to help slow down carbohydrate absorption in the gastrointestinal tract. This one's specifically working in the intestines. So these drugs are for type 2 diabetics. They are not for lowering fasting glucose levels. The adverse effects are going to be GI issues. You're working in the gastrointestinal system, so you're probably going to have some gastrointestinal issues. It's contraindicated in patients who already have gastric intestinal issues, or if they have malabsorption obstruction. Nursing implications, you want to take this with the first bite of food, but this drug does not cause hypoglycemia, hyperinsulinemia, or weight gain, and it is good for postprandial glucose spikes. The next thing to know about this is that if like hypoglycemia, you must give the patient pure glucose, something that does not need to be digested in the body. So either pure glucose or the oral gel for this. Next category we're going to talk about are Dpp-4 inhibitors, Sglt2 or Januvia. This drug also acts in the intestines. I'll zoom in so you can see how to spell it. This is going to also increase insulin secretion, but it's also going to reduce the glucagon secretion. So it's very similar to the Sivanna Ureas, but this one is actually working inside the intestines as well. So this drug is going to be really good for type 2 diabetics, especially if they are dieting and exercising under doctor's direction. It's good for lowering fasting and post-meal glucose levels. Postprandial is going to be after a meal, postprandial. The adverse effects of these drugs are that they're going to cause weird things has lowered, and she didn't want to get into digoxin levels. So dig toxicity is a possibility. So that's something you need to look at, especially if your patient is already taking digoxin. Increase the risk of hypoglycemia. So the best way, our teacher was trying to describe this in class, and I came up with this really silly, I guess you'd say it's an analogy. So I want you to think of a big brother, a little brother, and a bully. So the big brother is going to do whatever he can to take care of his little brother. So if the little brother is being beat up by a bully, the big brother is going to come and beat up the bully. Well, this is drug, which is Sglt2, that's the generic name. The little brother is incretin, that's the hormone that's going on in your intestines. And the bully is Dpp-4. So your body is going to try to delay the incretin breakdown, which is going to help slow gastric emptying. So Januvia is the big brother. He's going to come in and say, whoa, hold off, Dpp-4. Stop beating up my little brother, which is incretin inside your body. So this will allow incretin to work longer inside your body and slow down gastric emptying. So incretin is telling your body to make more insulin as well inside your body. So you're just going to have a feeling of fullness instead of having that satiety feeling go away as quickly, I guess. The next category are the glitazones. Pioglitazone is the generic name and Actos is the brand name. This is going to be a drug that's insulin sensitizing. It's going to make your body better respond to insulin. So this is going to help increase glucose uptake but decrease insulin resistance. So this is really good for type 2 diabetics because it helps preserve beta cell function. It's going to slow down the disease progression. Adverse effects include weight gain and peripheral edema. So a nursing implication for this drug includes weighing your patient every day, especially if they have other comorbidities like heart failure or if they have peripheral vascular disease. You're going to want to weigh your patients every day to monitor their weight gain, obviously, and it will monitor any edema that they have. This is going to be contraindicated in patients who have heart failure and just exacerbate the edema. And there is a black box warning for glitazones, and it's for heart failure, luckily enough. The next category and the second last we're going to talk about are the biguanides. I can never say that. The drug here is Metformin. That's the generic name, and the brand name is glucophage. This drug is going to act in the liver and in the tissues. There you go. It does not increase insulin secretion, but it's going to have lower glucose production and lower GI absorption. So the adverse effects are going to be GI issues and possibly a decreased level of B12 absorbed in the body, vitamin B12. So the nursing implications are that the doctor is going to tell the patient to slowly taper up this drug. So take one 500 milligram tablet in the morning for a week. And then take one 500 milligram tablet in the morning and then one 500 milligram tablet in the evening every day for a week and continue up until they get to, I think the approximate range that the doctor wants to get to is 2,000 milligrams a day. So eventually, ideally, they should be doing 1,000 in the morning and 1,000 in the evening. This also, you can tell your patients to take it 30 minutes before a meal to help lessen the GI discomfort. It is also contraindicated in patients who have renal failure. And there is a black box warning with metformin for lactic acidosis, and it's also increased with renal failure. This is because it's heavily excreted through the kidneys. So you're going to want to tell your patients or check with your patients if they're in the hospital, if they're taking metformin, that you need to discontinue the use of the drug about a day, 24 hours before they have a contrast dye test, and continue that discontinuedness of the drug 48 hours after the test. That's because the drug and the contrast dye that's used in that test can interact and cause lactic acidosis. The last category is the Sglt2 inhibitors, which act in the kidneys. And I'm not going to be able to say this drug name, but we're going to try anyway. Canagliflozin, I guess that's how you're going to say it. The brand name, luckily, is Invokana, so I can say that. The way that this drug works is that it's going to stop the reabsorption of glucose in the kidneys, specifically the proximal renal tubules, and it's going to be working independently of insulin. So luckily, we can use this for both type 1 and type 2 diabetics. The adverse effects are going to be genital yeast infections, UTI, and increased urination. The drug is working in the kidneys. So if there's going to be increased sugar going into the kidneys to be excreted from the body, there's an increased risk of those UTIs and yeast infections. It's contraindicated in diabetic ketoacidosis and renal impairment. Again, if your kidneys aren't working well, you're not going to want to give them a drug that's working in the kidneys. There's a black box warning for these drugs that increases the risk of leg and foot amputations because of the increased risk of infections. So that's something you definitely need to know and definitely need to look out for when your patients are taking the Sglt2 inhibitor drugs. So those are the 7 categories of oral anti-diabetics. I'm going to hold this here, so hopefully you can pause it or read whatever you need to read about it. And yeah.